welcome on behalf of MHPSS.net. We are really thrilled to be able to host this very exciting webinar about a new tool that all of us will be using. And the moderator for today is our colleague, Quiva Nikavor, who will be taking us through the webinar today. So I'm going to, without any further ado, hand over to you, Quiva.
Thanks so much, Ananda, and hello everyone. You're very welcome to this introductory session on the Multi-Sectoral Mental Health and Psychosocial Support Assessment Toolkit. So as you're probably aware, the field test version of this toolkit has just been released in the last few weeks. And today we're going to hear all about how the toolkit was developed, how it builds on previous assessment tools and toolkits. We're also going to get a quick tour of the content of the toolkit to understand what kind of guidance it offers and the different tools and templates that it provides. And then finally, we're going to learn more about this field testing phase that we're in at the moment and how you can get involved and help to make the final version as practical and useful as it can be. So as Ananda said, my name is Quiva Nikavor. I'm an MHPSS and child protection specialist at UNICEF headquarters, and I'm very happy to be moderating today. I'll introduce our different speakers as we go along, and I'll do my best to keep us on track with the time. We will have some time for questions and answers at the end, but quite a lot of people have registered. So to help us keep the questions organized and to be able to respond to as many as we can, please do write them in the chat. We might answer some in the chat as we go along, and then hopefully we'll have time as well to answer some in discussion at the end. If there's a lot we can't get through, we'll explore possibly having a follow-up or responding in writing in some other way. But without further ado, I think we can get started, and I'm very happy to introduce Dr. Fahmi Hanna to provide some opening remarks. Dr. Fahmi is based at WHO, but many of us know him as the co-chair, one of the co-chairs of the IASC MHPSS reference group, along with Dr. Carmen, who'll be speaking a little bit later. But to get started, I'll hand over to you, Fahmi.
Quiva, thank you so much. It's a privilege and honor, colleagues, to be with you launching the field testing today of this important toolkit. My name is Fahmi Hanna, and I'm the WHO co-chair of the IC MHPSS reference group. Colleagues, I heard once the former protection cluster coordinator, William Shamali, saying MHPSS is like a litmus test. It can tell him as a protection global cluster coordinator when he go to any country, whether mental health and psychosocial support, and not only actually mental health and psychosocial support, according to his own words, if various clusters and sectors are able to function together through a multi-sectoral approach. I think I agree with him. MHPSS is always a good litmus test for multi-sectorality. Interconnected needs would require interconnected response. And interconnected response would require always interconnected assessment. And I'm grateful for the colleagues, the team within the IC reference group, the various agencies involved, that they decided that we can no longer take standalone specific sectors assessment, and for ethical reasons, resource-wise reasons, and practical purposes, we need to do multi-sectoral interagency assessments. Colleagues, empathy and data can drive good MHPSS humanitarian response, and good quality assessment through good consensus-based and evidence-based interagency tools, such as the assessment tool we're using today, can be the true compass that should always guide our response to avoid duplication, avoid irrelevant assessment, and even worse, avoiding harmful MHPSS responses. I'm grateful for the opportunity to open today and looking forward to the presentation. Thanks for all the colleagues and agencies involved in this amazing and critical work.
Thank you so much, Fahmi. And so now we're going to get started and hand over to Dr. Michelle Engels. So Michelle led the development of the toolkit as a consultant with WHO, and she's going to give us some background on how the toolkit was developed. So over to you, Michelle.
Thank you very much, Quiva. Yeah, so I would like to give you a bit of an overview of the various steps we undertook. But first of all, as Fahmi was highlighting, ultimately a need was identified for updated guidance on mapping and assessments of MHPSS needs and resources in humanitarian settings. So we know that we have the WHO and UNHCR assessment toolkit that was released back in 2012, but 10 plus years has passed since that was last released. And there was an interest to really build on lessons that's been learned over that time from previous and current emergencies. As Fahmi was highlighting as well, there was really that desire to make it truly multi-sectoral, to really strengthen that intersectoral coordination and collaboration aspect. So we wanted to make sure that all sectors and AORs were very visible throughout the toolkit. And another ambition was to have an updated toolkit that also strengthened the integration of MHPSS into core humanitarian processes. So an example of that many of you might be familiar with is the humanitarian needs and response plans that are released annually in emergency settings. Sometimes MHPSS is mentioned there, sometimes it's not. And if it is, the consistency differs depending on the report and the context. So there was a desire to systematize that a little bit more, at least from the assessment angle. So in response to those identified needs, the thematic group on mapping and assessments in a humanitarian context was established. And this group is co-led by WHO and MHPSS.net. And it has 14 members that represent, it has members that represent 14 different agencies, rather, as part of its membership. The main mandate of this group was to deliver this updated toolkit and assessment on assessments and mapping, and to do that by reviewing what exists in terms of assessment methodologies, tools, and lessons learned. So the methodology we undertook was quite rigorous, and I'll ask you to move to the next slide, please. A few different steps were a part of it. You can see we actually released a few different surveys. So the first survey was asking persons who had conducted MHPSS needs assessments in emergency settings to tell us what tools they use, to give us information about the types of methodologies, what toolkits they use, what was helpful in those toolkits, perhaps what they didn't know back then that they would wish they knew for the future assessments. And this practice-based experience was really helpful to guide us to really capture those lessons that have been learned over the past 10 plus years. We also released an additional survey that was looking at mapping exercises and different people's experiences, both conducting and participating in them. So we sent out one survey to persons who had facilitated mapping exercises to ask what that process was like, what challenges they faced. But we also disseminated a survey to participants of the mapping exercise. So this could be just one representative from an agency entering in their agency's activities details into a 4Ws Excel tool, as an example. And that was really helpful because we learned from them, what worked in the existing tools, what was challenging, were the activity codes understandable, or, were there some amendments that needed to be made. We also, in parallel to that, reviewed a range of existing reports on assessments and mapping for MHPSS in emergency contexts. So we looked very broadly, again, to try and identify what tools were most commonly being used and what methodologies were most commonly being used. Interesting in these reports as well, they often cite limitations, and that was really helpful to guide us to know what kind of guidance was most needed for assessments to kind of, debunk those common pitfalls that people are falling into when conducting assessments. We also collated MHPSS assessment tools, toolkits, and guidance documents. So a mail out was sent out through the IASC reference group to ask anyone who had conducted an MHPSS assessment to please send us their reports, but also send us the tools that they used and the guidance that they used. And that was very helpful for us so that we could see the broad range of different tools and toolkits that were being used. And of course, we looked at MHPSS, but we also looked more broadly. So we looked across sectors and AORs. And that was really important for us because we wanted to see what other sectors and AORs were doing, but we also wanted to see what MHPSS components might be included in those tools as well, because we really wanted to highlight that in an updated toolkit. I mentioned a need that was identified earlier was about integrating MHPSS within core humanitarian processes. So another review that we did was we looked at core humanitarian documents to see if and how MHPSS was represented. So we looked at multi-sectoral needs assessments, humanitarian response plans, and needs overviews and refugee response plans. And we saw that MHPSS wasn't always included, but when it was, it tended to be included under protection, health, and then followed by education. And it was quite varied in terms of how it was reported on. And then finally, we conducted key informant interviews, and you can see we spoke to a broad range of people, 36 different informants across NGOs, the Red Cross, Red Crescent movement, UN agencies, governments and donor representatives as well. And again, we wanted to learn from them, what would they really like to see in updated guidance? What do they think would be most important for people to reflect on based on the previous 10 years in the field? And so then we collated all that information to provide a draft toolkit. So if we can move to the next slide, that draft toolkit was then disseminated to all thematic group members for review. And it was also disseminated for external review twice. So that first review was to all representatives of sectors, AORs, to get their feedback on the toolkit. And that was important to make sure that we were hitting all the core points and we were mentioning the core tools. And then based on their feedback, we adjusted the toolkit, added in new tools based on what they had told us was really important to highlight. And we developed the second draft of the toolkit and disseminated it again to the sectors and AORs, but also to the IS members, observers, and donors mailing list. So we received feedback from 23 individuals, and many of them collated their feedback across their organization. So we got broad representation, and that also included three persons with lived experience of a mental health condition, which is important because we included a tool capturing their perspective as well in the toolkit. So I will hand it back to Quiva at this point.
Thanks so much, Michelle. Next, we're going to hear from Dr. Inke Weisbecker, who's going to bring us up to speed on what's new in this toolkit and how it differs from previous ones. So Inke is a technical officer at WHO, and she co-chairs the IASC thematic group on mapping and assessment that Michelle was telling us about, together with Marcio, our next speaker. So over to you, Inke.
Thank you so much, Quiva. And it's wonderful to see so many of you online and so many people who share our interest and passion in MHPSS assessments, which are so critical in guiding the response and making sure MHPSS is considered in any humanitarian response. So based on all this feedback and consultations that Michelle just mentioned, what did we do? So I will give you a quick overview of that. What did we change? What did we improve? First of all, from what we learned in our consultations, we have now more guidance on how to select tools. So we hope that looking at this toolkit will be less overwhelming, and you actually have a table in there about for what purpose would which tools be used. We also have guidance on participatory approaches, so specific tools and further readings. Guidance also on contextual and cultural adaptations, which are so important. Each of the tools in the toolkit actually has a link to download a Word version of the tool. And that is because these tools are not written in stone. We want you to change them. We want you to adapt them. We want you to translate them. And that's why we make it easy and we have a Word version included everywhere. We also have guidance on how to make translations, how to make adaptations, what to watch out for. In addition, another big ask we got through these consultations is including more about at-risk populations. So we have considerations there about how can we include diverse and at-risk groups in assessments. How should we consider gender? How should we include older people, which is often a big gap in assessments and in the response? How can we better include people with disabilities? How can we include people with lived experience of a mental health condition? We also have specific guidance for including children, like safe assessments procedures, child-friendly methods across different ages and stages of development. We also have learned in our consultations that assessments are often not coordinated. For example, not coordinated very well with MHPSS technical working groups or other coordination mechanisms, and that often assessment findings are actually not shared, which means that there may be duplication of efforts and not really good use of resources. So we have included guidance on how to best coordinate and share assessment findings, including different methods of sharing, templates for reports, templates for even brief PowerPoint presentations. Also, since much of the MHPSS assessment guidance was published over 10 years ago, there have been many technological advances, which are now also included in the toolkit, such as social and community listening, GIS, Kobo Toolbox, and so on. We can go to the next slide, which now notes some changes in the tools. So although the toolkit actually has a lot of information and a lot of tools, we also put emphasis on simplification, making things straightforward and clear and keeping with the need to know and the practical aspects. Also, many tools include two versions of the same tool, one brief kind of version that's very quick and one more comprehensive version to kind of respond to the fact that contexts are different and sometimes you have very little time and resources and sometimes you have more time and resources. So that is reflected there. In addition, many of you know about the MHPSS minimum service package, which includes the minimum activities which should be included in the MHPSS response, which also has something called a gap analysis. And then there's the 4Ws mapping tool, which is a bit different from the MSP. So we have now just one tool that is actually combining the MSP activities and the 4Ws so that you can do both a 4Ws mapping and the gap analysis at the same time. So we've made that easier. In addition, we have facility checklists included. Before that, we had checklists for health facilities, for psychiatric hospitals, but now we have gone further with the checklist with the idea of really making it multi-sectoral. So now we have facility checklists, not just for health, but also for education settings, community services, for camps or other settlements. In addition, we have example reporting templates to make it easier to write assessment reports. So we have templates for full assessment report, PowerPoint presentation of results, brief overviews, and so on. I also want to note that the updated toolkit does not include the HESPER. I don't know how many of you know about the HESPER, but that's basically asking about all the different needs that people may have, water, nutrition, general health, and so on. That's not because the HESPER is useful. It is actually available as tool, is actually available in the toolkit still in the table where it's linked as a cross-sectoral tool. So because the HESPER has its own guidance, so it's still in there. However, we do not have the neuropsychiatric HIS from the old WHO UNHCR toolkit because we now have updated HIS categories which are linked in there as well. And now I will hand it back over to Quiva, who's moderating.
Thank you, Inka. Great. So now we're going to hear from Dr. Marcio Gagliato, who is the co-director of the Mental Health and Psychosocial Support Network, which many of us know as MHPSS.net. Marcio also co-chairs the Assessment and Mapping thematic group together with Inka, and he's going to tell us a bit more about the content of the toolkit. So over to you, Marcio.
Thank you so much, Quiva. Thank you so much, colleagues from all over the world for being here today. This is such an exciting and historical moment to be officially launching this toolkit. We have here, this is representing almost 2 years of work behind, and today we are landing to show and to introduce this important tool, which comes with very big questions behind. How are people affected by crisis and the different types of crisis and the different types of populations? How do we identify people we need? how do we identify the needs of the population, not only the needs of the population, but the resources of affected population, and with different types of crises and different moments of the crisis as well. Those are big questions, and here we are to unpack a little bit where we have landed in terms of making this toolkit as very instrumental to the whole field, with those very big questions that we are facing for every context of crisis and humanitarian challenge nowadays. So basically, unpacking the toolkit, this toolkit have four different chapters. The first chapter is which provides the overview of the toolkit, its purpose and use. The second chapter, it's where it describes the different steps for doing an MHPSS assessment, outlining key activities for each of them. The third chapter is where it's stressed, and I think this is a kind of one of the new points in terms of highlighting the need for integrating MHPSS into different sectors, having this as a multi-sectoral approach, a multi-sectoral tool, and how to integrate MHPSS across the different sectors. And the last chapter, which is the biggest part of the document, is where we present the different tools, recommended tools, reviewed tools for different types of scenarios and for different purposes as well. Next slide, please. So going to the first chapter is where we start presenting the background about the MHPSS needs assessment, the core principles of assessments, what assessments are, what it should not be, the different models that assessments can take place in terms of depends on the availability of time, the resources, the scope of the assessment. Assessments that can be done very quickly in particular phases of the crisis, or assessments that can be very detailed, very systematic to inform a wide range of stakeholders and different types of stakeholders and the purposes as well. Assuming that the different purposes that assessments can have, such as informing actions, informing program, informing action, identifying target populations, the needs and resources of affected populations, as well as for coordination purposes, so helping to integrate MHPSS across different sectors, and perhaps to simply develop a service map, a referral pathway, or still for advocacy in terms of supporting awareness, communicating needs, and even helping with funding appeals. This toolkit that we have launched today, it's a multi-sectoral toolkit in nature. It really explores how MHPSS can and should be integrated across different sectors, clusters, and areas of responsibilities. It outlines 10 core principles, which are very critical to guide and to read throughout the different contexts in the toolkit, those core principles. Core principles such as not only assessing needs of the population, don't forget to also assess the resources of the population, how the people are coping with that context. To be mindful about dynamics in places that can be political, that can be related to power dynamics and side dynamics, to reinforce as a core principle in terms of conducting joint assessments, instead of having 10 assessments, to conduct perhaps one assessment with the different stakeholders, and then the responsibility, the ethical responsibility of sharing the results of assessment. As Inka said, we identified as one gap when we were conducting the review, that not every agency would be sharing those results. And throughout this toolkit, you can see those symbols in the slide, which are used to represent the different sectors, clusters in the area of responsibilities. Next slide, please. In this chapter is also, in the chapter 1, it is to explores how what should be included in the MHPSS assessment, provide an overview of the relevant information that may be collected as part of the MHPSS assessment exercise, and together suggesting different tools, such as information about the context, the demographics, the source of problems and stressors from the crisis, local expression of idioms or distress or health in terms of how people are coping with that, instruments to identify the systems in place for the community or from the policy or from the framework, and not only, but also the availability of those services, how those services are accessible, how people are accessing those services, and also the quality of those services. Next slide, please. Here in this chapter 2 is the I would say that perhaps it's 15 pages. This part of the document is a large portion of the document, despite the last chapter. But last chapter, let's say it's like a more type of annexes. But in terms of if we could divide a theoretical part, this is the biggest part of the document, which really try to explore what are the steps, the different steps for conducting an MHPSS assessment. Which starts by sounding perhaps a obvious starting point, which is what do we already know about the context? How can, and stressing really this point in terms of going to any given context where a humanitarian situation is happening, in terms of how to get the information of what is already available. What do we already know about that particular context? And sometimes doing this exercise of getting to know about the context might be already sufficient and no further step will be needed for that particular context. It also, in this chapter, it offers, for example, the possible use of existing prevalence estimates, which is an often question that we all face in different humanitarian crises. How do we know that people are affected? What kind of conditions people are facing, or what's the distress that they are having? And how can we identify the number of those people in terms of building systems and services according to their needs precisely? No, this is an often question that we have. It also, in this chapter, it also helps to set in the scope, the parameters of the assessment and the tools that we would be using for that. And in this chapter, it is also stressed very much the need and the expectation that this toolkit is not a top-down type of exercise, but it's actually, we expect a contextual adaptation through a very much participatory approach. Next slide, please. Then we land for the third chapter, which is about 11 pages, which is all about why and how to integrate MHPSS into other sectors. Basically, there are lots of information and instruments, very straightforward. So the guidelines really doesn't discuss many things, it's just like present several tools and in a very straightforward way in how to support the actors, the different actors from other sectors, going beyond health, engaging educational sector, engaging the social services sector, so-called protection sector, engaging preparedness sectors, engaging the security force sectors, in how to integrate MHPSS and questions in their planning, in their designing and implementation of their analysis of the needs of and resources of affected population. This chapter is where it explores the humanitarian program cycle operational framework, which sets out the sequence of actions to prepare for an emergency when it takes place. So plan, mobilize resources, implement and monitor, and evaluate and report on collective responses. It shows how to include the MHPSS considerations into the MIRA assessment, the multi-sectoral initial rapid assessment that takes place in the few days of an emergency. Also, how to integrate with the joint intersectoral analysis framework and the humanitarian response plans, which are standard frameworks of assessment and reports in the humanitarian field. Next one, please. And here is the golden part, I would assume. No, I mean, it's the golden part in a way that the chapter 4 is extensive. We are talking about almost 100 pages where it is unpacking different tools and resources that can be used when conducting mental health and psychosocial support needs and resource assessment. It starts by desk review. What do we already know with this basic question? I think many of you may feel quite similar to the context where you are going to know a specific context is to get to know what is already there in place. Otherwise, it's very difficult to start from nowhere, right? So this offers two templates, a brief desk review template that can be done as long as 1 day kind of exercise, or a more comprehensive desk review template, which requires, for example, a review of the cultural norms, the social norms, the policy in place, and so on and so forth. So it's a good portion that is actually very instrumental for all of us trying to do any kind of intervention in a given context. Next one, please. Then we have the who is doing what, where, and when, the 4 Ws question. We have reviewed the traditional 4 Ws, the so popular 4 Ws, the mapping exercise, and we have arrived in a place where you offer 3 different templates. One template is the mapping, the simplified mapping of actors and activities taking place in a given context and can be done and expect to be done at a very early stage of emergency. Also a simplified version of not only identifying actors and activities that they're doing, but also to focus on the services, mapping the services available for the community, which is a kind of a new instrument when we talk about the MHPSS history. This is new in this toolkit. And then the third one, which is a comprehensive full MHPSS mapping exercise. Next one. This is just to show that those screenshots of the document that you have show some aspects of the tool. On the left, there is a core information that should be collected as part of our mappings. Additional mapping items can then be added according to the different purpose of the mapping. For example, if it's establishing referral pathways, service dictatories, or fundraiser efforts. And on the right is a small snippet of how the activities codes have been aligned with the minimal surface package, with the MSP, while still keeping the original activities, often to ensure broad activity coverage. Next one. There is a dedicated space for MHPSS household surveys, basically trying to understand, is a tool to understand how common are mental health problems and how are people accessing care. This is a tool to support advocacy and programming planning by estimating the extent of mental distress in a community, understanding some of their help-seeking behaviors, and trying to identify gaps in access to care. It's where it's offer guidance in terms of how to use data collected to contribute to an estimate of people in need, the PIN calculation that is so needed and used in humanitarian needs overview documents. Next one, please. This is another tool which I think it's quite central as well, which is the aspect of community stakeholder perceptions. What are the problems and resources in the community from the community perspective? It's really where it's why to use the community and stakeholders point of view, how to interview, how to have group discussions, how methodologies that can guide us in terms of understanding and getting their perception, what is happening from the community point of view. And the next slide, please, in the last slide, is what we call the facility and site checklist. This checklist, so instruments, different checking lists when going to psychiatric institutions, health institutions, education settings, community settings, and what to be observing when doing that, how to be conducting those visits in a way that can be informative for the assessment that is taking place. Thank you very much, and now lending it back to you, Inka. I know it's extensive, but don't get scared. There will be several chances for unpacking this more in deep.
Great, thank you, Marcio. So now we have the field test version out, which means we are field testing it this year to make it even better next year. So next year, in about a year's time, we hope to publish it as an ISC product. But before that, we want to hear from all of you about how you find the toolkit. How can we improve it? And we don't want to just publish it. We want to make sure it's usable, it's feasible, it's practical. So the field testing will be until the end of this year. Anybody can use the toolkit. Nobody's keeping you. So use the toolkit as much as you want. You don't need to ask us for permission or anything. Please run with it. But we would be so grateful if you would fill out the feedback survey if you do use it. And there's the link there in the slide for us to hear about your experience and get feedback. We're also more formally field testing the toolkit this year in at least 5 countries. And if you're interested in being part of the more formal field testing process and work with us more closely, there are a few things that we can offer. We can offer technical support to just kind of give some advice and input. We can offer deployment of an expert who can help you on the ground. And we can offer some financial support, which is through a competitive process and expression of interest. And I'll paste some information on that in the chat as well. What field testing then would mean would be using one or more tools from the toolkit in a humanitarian setting to assess mental health and psychosocial support needs and resources. It would mean writing up the findings, like an assessment report or desktop review, mapping report, MHPSS section of a multi-sectoral report. It would mean sharing of the assessment report or a summary of sorts. You don't need to share all the data you collect in every single thing, but some sort of summary that gives us and others a sense for what has been assessed and what the findings are. And then, of course, providing some information about the assessment process, like what steps have you taken? Have you adapted any tools? How was the assessment shared? And especially any actions planned or resulting from the assessments. Assessment always needs to lead to action. We never just want to assess for the sake of it. And we actually should know what actions we could possibly take beforehand so that we make sure whatever data we collect can be turned into action at the end. So that's what field testing would mean, and of course, filling out the survey. I will paste some information in the chat about who to contact, which is actually Michelle, our focal point to contact her for questions, and then all of us are involved in the team as well. But that's it from the field testing. And now I think I'm turning it over to Quiva.
Thanks so much, Inka, and thank you to all our speakers. I think those presentations have really been helpful in highlighting the added value of this toolkit and the richness of all these different tools and showing us what this toolkit can offer beyond what was in existence before, whether that's in terms of providing general guidance on how to conduct an assessment, or indeed giving us very specific, concrete, practical tools and templates that we can just take and use in our work. So it's really great to see as well how much consultation and review went into the development of this toolkit. So it was obviously developed through a really robust process, and I think the field testing will only make it even more practical and more relevant. So hopefully lots of us can bring it back to our colleagues and use it in our organizations, find opportunities to try it out and test it with different populations and in different contexts. I know from a UNICEF perspective, we're really excited to see some child-focused tools in there. So for example, there are interview guides to use with children in humanitarian settings, and that's something we didn't see in the older version of the toolkit. So it's something I'd really like to see tested and strengthened through the field testing process. So the more feedback that all of us as a global MHPSS community can provide, then the more we can bring this from strength to strength, as Inka said there. So before we move into our questions and answers session, I'm very happy to be able to hand over to Carmen Valle-Trabadeo for some final reflections before we go into the questions. So Carmen is based at the IFRC Psychosocial Centre, and she co-leads the IASC MHPSS reference group along with Fahmi. So over to you, Carmen. Or perhaps Carmen's mic is not working.
Sorry, I was muted.
Oh, great.
Thank you so much, Quiva, and thank you so much, colleagues, from that very, very interesting presentation. My remarks are very short. I just want to highlight again how much of this toolkit is coming from a need that has been identified by all of you. The fact that more than 250 colleagues have been joining us today in this call, the fact that you come from all over the world and that you are very active implementers of MHPSS activities in very different sectors, tell us how important this tool is. The need was identified from the ground. It comes from that need that everybody's telling us we need to refresh tools. We need to look back into our existing tools to make them up to date. The efforts, if you've been following all of the different sections and parts of this toolkit, are so clearly based on identified needs, on identified areas of concern, on identified gaps. And that is so, so useful. So now, if we want to really succeed, as our colleagues were saying, the ball goes all the way back to you, dear colleagues. It will be even better, it will be even more useful, the more it continues to be based on the realities on the ground. So I'm just echoing my colleagues on encouraging organizations and groups on the ground to take it, use it, and give us feedback so it can continue to be really, really based on what you, on your implementations, are finding useful. On our side, on the reference group side, we've been really encouraged by the support of the technical working groups and the interest of the coordination groups in all countries, and we will continue to support you all in that taking on this tool. My final word is a big thank you, not only to our wonderful colleagues presenting today, but all of the agencies, WHO and MHPSS.net, co-leading that thematic group that has lead on this process, but also all of the agencies that have been inputted. I know IFRC was very interested in inputting on the tool. I know many agencies have been part of this effort, and I think the result shows. So my final word is a thank you and a massive congratulations on this field version. So we still have a little bit of work to do to compile information and feedback and making it a final version. But up till now, really congratulations. And I'm really looking forward to hear the answers to some of the very interesting questions that are already popping up on the chat. Colleagues, over to you. And again, thank you and congrats.
Thank you so much, Carmen. It's lovely to have you join us today as well. So, and thank you to all our speakers. We have done very well for keeping on time. So we have about 15 minutes for some questions and answers. And some of our colleagues have been helping to compile them in a document here. So I'm going to try and group a few of them together. We've had a few questions about specific groups. For example, are people with disabilities included in the tool? And if yes, where in the toolkit can I find that information? And we've also had a question about whether persons with lived experience have been included. So I believe we maybe touched on that a little bit in Michelle's presentation, but Michelle, I don't know if you would like to give a little bit more information on that side of things? Or any of our speakers, of course, are welcome. Go ahead, Michelle.
Yeah, so persons with disabilities are mentioned in the toolkit as a population that could be of interest as part of assessments, along with a host of other populations, including persons with lived experience of a mental health condition. But we also have broad guidance in there because we couldn't mention every at-risk group. You know, I know someone in the chat mentioned persons living with cancer. That's not specifically mentioned in the toolkit. So instead, what we've done is we've also included broad guidance that links to the MSP actually on how to identify unique at-risk groups within your setting, because it can be quite setting dependent. And you will find that guidance in chapter 2, section 2.2.3. I did add it in the chat, but you will find that there, and it includes a host of different populations, including also children, and working with different genders as well. So there were considerations with that. I think there was also mention of were persons with lived experience included in the development of the toolkit, and we did consult them as part of key informant interviews, and we also had them review the tool that focused on persons with lived experience. So in the toolkit, you'll find it's tool 8 that's specific to persons with lived experience, and that has been reviewed by 3 members from that community as well.
Fantastic. Thanks, Michelle. I think that's really clear. We also had an interesting question about participation of community members and affected populations. So one of our colleagues asks, during the development of the toolkit, was there a gap identified when it comes to sharing assessment results, not just with humanitarian actors, but also back to the communities themselves? And also have they been participated in the design of interventions and implementations after the assessment? So I don't know if any of you would like to take that.
Well, I can just perhaps add here, Quiva, that yes, the answer for this, it's almost immediate in terms of if the sharings was not done with the peers organizations that often are looking at the results of the assessments taking place in a given emergency setting to inform their own process. Imagine the community, because for the community to have access to it, it means that somehow the document or the results of it has been made public. No? I think there are two lessons here that we have taken for this. One is it's a question for all of us as a field to wonder and to further explore why this practice happens in terms of not sharing some fundamental information, which are not necessarily sensitive. Of course, there are assessments that are done in a sensitive way in terms of sharing information, and we need to be careful about that kind of information. And this is also acknowledged in the toolkit. But the second point here is to transform this as one of the core principles. So each of those 10 core principles that are there are pillars of engagement for any given setting in terms of the minimum that we expect in terms of engagement between different actors. And that give us in the field main means of engagement with actors that perhaps might not be familiar even with those core principles, and and that's why it becomes a core principle. Core principle because we have learned over the past 20 years of this field, sometimes from the mistakes that we do in the field as well, to transform this as a gold core illuminating starting point to guide the field in terms of sharing assessments, for example.
Thanks so much, Marcio, for that comprehensive answer. We've had an interesting question from someone asking, at the moment, is there a centralized place where this assessment data will live so that mental health professionals can benefit from the data collected by their colleagues in other places? So I think it's about asking whether, all these assessments could be shared in one place where everybody could see how other people have conducted assessments and see the other data collected.
I think I will jump here again because we are very pleased to inform that yes, this is taking place at the moment. MHPSS.net we have collected so many in the desk review process, so many reports that has been already available in the field, but we managed to, in this desk review process, to systematically organize them and receive them from different agencies across the globe. So there was an extensive process of work for this, and MHPSS.net is actually building a dedicated space to make a friendly user repository of all those assessments that has been conducted. So it's not going to be the only place, but definitely is one of the places where this will also be hosted.
Thanks, Marcio. I think that will be a fantastic resource because I think there are assessments out there, but they're not, that are already published, but they're not always easy to find, or they might just be shared, or they might not be shared, or they might just be shared within a specific technical working group in a specific setting. So the more we can all benefit from the experiences other people have had in conducting assessments, I think the stronger and the more robust our assessments are going to be, both in terms of standalone MHPSS assessments, but also as what's really being advanced with this toolkit is more robust integration of MHPSS questions and items into multi-sectoral assessments, and also assessments of particular sectors or areas of responsibility. So it's really exciting to see that moving forward. And I think we'll just see more and more integration of MHPSS, the more we integrate the needs assessment questions into the different sectors. So we've had some questions on a kind of more methodology as well about how to actually conduct assessments. And someone has mentioned that in the assessment toolkit, the tools are provided, but there aren't prescriptive kind of rules about, for example, the sample size. So how many people you should interview or how many people should be involved in a household survey. I wonder if you might elaborate a little bit on, you know, how prescriptive you've decided to be, or how much you've decided to leave to the specific context to decide in terms of the methodology.
Maybe Michelle could take that one.
Yeah, I'm happy to jump in there. So when it comes to methodology, we actually struggled with this one a little bit when we were drafting the toolkit, because there is so much guidance out there on calculating sample sizes, and it can get very complicated, especially if you're doing large scale surveys. There's so many different sampling methodologies, and that will influence your sample size calculations. So we were playing around, you know, and we were talking to obviously our key informants and the thematic group on what would be the best way to approach this. And ultimately we decided it's best not to be too prescriptive. If we provide detailed guidance on this many sample sizes required and this is the type of calculation you do, then it becomes very confined, and there may be settings where that benchmark is not able to be met for whatever reason. So obviously, there are links within the toolkit, and there's a lot of further readings that we have linked to, that if you want to do a large scale survey and you want to calculate sample sizes, we've linked directly to resources that provide an overview of how to do that. So that is there if you have that interest to really calculate a sample size and figure out different sampling methodologies. You will find links within the toolkit. But within the assessment toolkit itself, we've kept the guidance a little bit more vague, with the understanding that assessments can look really different in different contexts. And sometimes an assessment might just be being in a setting and interviewing 2 people, and that's unfortunately the best you can do because you don't have any other access. So in those kind of situations, calculating sample sizes, you know, won't be useful for you. So we tried to avoid being too detailed and prescriptive, but there is certainly further readings and links to that information for those who are doing more extensive sampling.
Thanks so much, Michelle. I think that makes sense, that it's always a balance with these things, whether, you know, how prescriptive we are in sort of global tools and how much needs to be determined at the local level, depending on the resources available in the specific context. We've had some questions about the definition of crisis, and also some questions about whether the tool is specifically or can only be used in humanitarian settings. So specifically, someone has said that the document in general, but also tools 6A and 6B specifically talk about crisis, and they're asking how crisis is defined. If any of our developers would be able to take that one. I know that on the humanitarian, whether it's only for humanitarian settings, I think that's been answered in the chat, but maybe you'd like to elaborate a little bit more. Over to you, Inka.
Yeah, I mean, it's basically usually a crisis, a humanitarian crisis, like a natural disaster or armed conflict or radionuclear disaster or public health emergency, basically. So that's usually where we need a rapid response, where humanitarian or refugee response plans are developed, and we quickly need to communicate about the MHPSS needs. And that's kind of the spirit of it, that it's made to quickly and easily be used. But of course, it can also be relevant to other settings and could be adapted. I think the adaptation is key. Knowing, of course, that, you know, in those more development settings, even you also need probably additional tools and more information about systems, for example, like how systems are structured, how mental health systems and services look like, how social services look like, what cadres of professional staff exist in the country, psychiatrists, psychologists, social workers. So you would probably dig deeper into the systems level as well. We need to know about the systems level in a humanitarian crisis as well. But if you really want to do development work, then you need to get into much more detail on that. Over.
Thanks, Inka. I think we have about 4 minutes, so I'll maybe try and squeeze in a couple of more. Well, I don't know if we'll get to all of them. There was a question about cultural adaptation. Oh, I believe that one actually was answered via the chat, so I'll leave that one. We've had a few about the geographical region that you might define for doing an assessment. So people have asked, if multiple tools are being used for the field testing, do we have to implement them with one specific population group or in one specific geographical area? And another person has asked a similar question: if an agency is testing a set of tools in a particular state, do all of the tools have to be tested in the same site or location to consolidate the assessment, or is it okay to test some tools in some locations or with some populations and others with other populations and locations?
I would say, I would easily say that not the expectation, that's why it's a toolkit. So it's a kind of a menu of different resources, and that will depend on the purpose of the assessment, the time that you have, the context of the emergency, the mandate of your agency as well, you know, in terms of the focus that your agency is giving. So it's really a toolkit in a way that it offers a range of different tools that which tool are going to be used, it will depend again, and that is really well explored in the toolkit. It will depend on several questions that need to be pre-answered. And as I said, sometimes even a desk review by itself, you already answer most of the questions and you don't need to engage the other parts of it. But mappings are going probably to be relevant for every single context, but perhaps there are, in the desk review, there are really well placed mapping exercises that are being conducted by the government, the local administration, for instance, and so you don't do another MHPSS 4Ws, for instance. I just want to perhaps conclude one part here that do not forget two things. One is that this is a field test version. So it is really expected that we are going to learn from the implementation now to revisit this version that we have today to perhaps change or make improvements. So your feedback in that sense is really essential. This is a live document that we do expect the field to tell us what has worked, what did not work, what is still missing there. Remember that is a global document, a global tool. It's really hard to make that suitable to every single context, and it is expected, as in the page 1, contextualization of this tool, how to make this tool relevant to that context, and not how to simply implement the document or the specific tool as it is in any particular given context, because we do expect that as being instrumental to your work and to the big questions, not to be the answers of the big question.
Thank you so much, Marcio. And that brings us right up to time, and I think it's a nice thought to conclude on. So I'd like to thank our speakers again for all the work that's gone into the development of the toolkit, but also for helping us all to get familiar with it today. And I'd also like to thank the whole team at MHPSS.net who do a whole lot of work behind the scenes to, let us all know that these webinars are happening, to manage all the technical side of things, and really keep us all informed as these innovations are released and as they progress. So if anyone has any further questions, or if you need any support implementing the toolkit, feel free to reach out to the team, to Marcio or Inka or Michelle, who's also still working on the development and the field testing. We'll pop their contact details into the chat so that they're there for you to copy and paste. And I think that's it. We'll wrap up. So thanks again for joining, everyone. It's really great to have so many of you here. Take care.
Thank you, everyone.
Thanks a lot.
Thank you so much, colleagues.
Thanks, everyone. We will be posting the recording of this webinar on the MHPSS.net YouTube channel. You can just go to YouTube and search MHPSS.net. It should be up in a day or two. But I will keep in touch with our colleagues. Thank you so much for a wonderful webinar and the start, I think, of many interesting conversations about this topic going forward.